Hello, everybody, and welcome to today's webcast. I'm Andy Coet, Communications Specialist at the UC Davis Correct Shelter Medicine Program in California. We're delighted to welcome Drs. Sandra Strong and Jody Gookin, who will provide information on survival statistics and novel treatments for orphan kitten diarrhea. Dr. Jody Gookin is nationally recognized for her expertise in gastroenterology, with a special emphasis on infectious causes of feline diarrheal disease. Dr. Gookin received her Doctor of Veterinary Medicine degree from the University of California at Davis and a PhD in gastrointestinal physiology at North Carolina State University. Dr. Sandra Strong is currently the Chief Veterinarian for Wake County Animal Services and a diplomat of the American College of Animal Welfare. Dr. Strong received her Doctor of Veterinary Medicine degree from North Carolina State University. Welcome, Dr. Gookin and Dr. Strong.
Thank you for that really kind introduction. We're very excited to be able to share this study with you. And we want to definitely thank Maddie's Fund and the Million Cat Challenge for inviting us to talk with you today. My name's Jody Gookin.
I'm Sandra Strong.
And we're going to just start by just a little bit of an introduction. Again, as was stated, my name's Jody Gookin. I am a faculty member at the College of Veterinary Medicine at North Carolina State University, boarded in small animal internal medicine, and have had a long-standing, strong clinical and research interest in gastroenterology, and believe it or not, a particular interest in feline diarrhea. So lucky me. I'm fortunate to have a very close working relationship with Sandra Strong and our Wake County Animal Center, where we have been able to study causes of GI disease in foster kittens now for the past several years. And so I'm going to turn this over to Sandra and have her do some introduction.
Thanks, Jody. I'm Sandra Strong, and I'm currently the Chief Veterinarian, Shelter Veterinarian at the Wake County Animal Center. And as Jody mentioned, I'm excited to be here today to be able to talk about the results of our study. And we want to talk a little bit about the Wake County Animal Center to give a background on.
I bet the group is probably really interested in the county center that was the origin of this study. So Sandra, you want to give us some background about the Animal Center?
Absolutely. So Wake County, Raleigh's the capital city of North Carolina, and the Wake County Animal Center is an open intake municipal shelter, and we serve a little over 1 million people here in Wake County, and that translates into 11,000 to 12,000 annual intake of animals coming through our shelter. And of those animals, we have about 1,800 kittens every kitten season that we are tasked with taking care of and placing eventually into homes and hopefully becoming senior cats. To do that, our kittens come in and they're on different pathways. If a kitten is already 2 pounds, they can go directly to the adoption floor, and we allow deposits during the stray hold, and those kittens are big enough to be spayed and neutered and adopted. The 2 other pathways are going to be the kittens may leave with one of our rescue transfer partners, or they may leave for foster care with one of our foster families. And we are lucky in that we have over 250 active foster parents who work with us, and our goal really is to get kittens less than 2 pounds out of the shelter the day they come in. But our average length of stay is about 3 days for underage kittens. And work done by Jody earlier in her lab has shown that in our community, we know the mortality of kittens is mainly from gastrointestinal disease, but also we have some mortality in our community from respiratory disease in our kittens.
Yeah, and there's a fair number of statistics on this, but this audience and Sandra knows a lot better than I do the real challenges that are faced with orphan kittens. But some of the statistics that I was able to sort of dig up, and I'd welcome any better statistics from anyone in the audience, because these are kind of difficult to find. But as of 2012, it was suggested that there's 74 million owned and 70 million feral cats in the United States. And these give rise to an estimated 180 million kittens per year. And what we don't really have a good estimate is on the actual number of these kittens that end up being relinquished to some 4,000 to 6,000 brick and mortar U.S. animal shelters, let alone the large, probably exceedingly numbered foster and rescue organizations that are out there, we recognize that probably about 21% of foster kittens will die or be euthanized due to illness before they reach the age of 12 weeks. And what is interesting is that an obvious cause is unknown in as many as 50% of these kittens. And the reason for that is that few studies have really been dedicated to understanding the causes of mortality in this population. The one that I would like to share that I think does a pretty good job understanding this was actually one that was published 17 years ago and came out of the United Kingdom. It was an autopsy-based study of kittens, and they looked at kittens in 4 different age groups. So these bars represent prenatal period kittens, neonatal period kittens, pre-weaning kittens, and post-weaning kittens. And what you can see under these bars is that this last bar, the post-weaning kittens, there was the greatest mortality in that group. And that's probably due to, the stress of weaning, potentially failure of passive transfer, crowding, sanitation, changes in diet that are all conspiring to make this population more vulnerable. The other thing this study showed was that infectious disease was a very common cause of death in this population. And these are shown by the yellow bars in this group. And 71% of the infections were viral, the most important clearly being panleukopenia, but followed closely by 20% were bacterial causes. The thing that we recognize in this study and in the few studies that have been looked at, and most certainly in our own personal clinical experience, is that these kittens often die with clinical signs or post-mortem evidence of intestinal disease. And I'll tell you that much of my career I've dedicated to trying to identify the causes for diarrhea and death in this population. So specific causes that we could diagnose and treat. And only with my work with Sandra have I realized how impractical and potentially low of an impact that might have in the type of setting of shelter medicine where, you don't have the time or the resources to actually diagnose disease in these kittens. And what it comes down to is empirical treatment strategies and what effect they actually have. And so, Sandra, can you kind of state kind of what our hypothesis was, what we actually tried to seek to do in the study?
Yeah, so what Jody and I were having a conversation, and we were discussing, we can't diagnose every cause of diarrhea in this population. As she mentioned, we don't have the resources or even the people available. And so I was sharing my frustration with how many foster kittens develop diarrhea while they're in foster care, and the fact that sometimes I feel like we're just throwing the kitchen sink, treating them with anything we can think to treat with. But I was struggling with knowing whether or not any of those treatments were having an effect, or, I was really looking for some evidence-based medicine, some evidence that our treatments were working. And so we came up with our study objective, which is basically to identify significant associations between empirical treatment interventions that we were providing kittens and the long-term survival or outcome of those foster kittens after they developed diarrhea. So that's what we did.
And so kind of what this looked like was the kittens would come in the shelter, and then they would get placed in foster with foster care providers. And if they developed diarrhea and were returned to the shelter to be seen by the shelter veterinarian, then they were entered into the study. And Sandra would record the treatments provided, and then ultimately we would look at what the outcome of the kitten was in terms of survival to reach an age to be spayed and neutered and put on the floor or transferred to an adoption partner. But I think it's important to understand the study to realize that a lot of the kittens were treated for some of the more common culprits of diarrhea before they ever went into foster care. So, Sandra, do you want to share with the group sort of what the background treatment that all of these kittens received before they even had possibly developed diarrhea and been included in the study?
Yes, so let's talk about the shelter intake procedure for all of our shelter colleagues out there. We know that intake procedures, or what we do with animals as they first enter the shelter is very important. So we do provide vaccination. It's the cornerstone of disease prevention. So all kittens coming into the animal center are going to receive a modified live herpes calicivirus panleukopenia vaccine if they're 4 weeks of age or older, and that roughly translates into about a pound, but not always. All the kittens are going to get a preventative dose of marquee or panazole for coccidia, and that's as a to provide preventative for coccidia, and then a deworming, which we use Strongit or Pyrantel, and then all kittens get Revolution topically for flea prevention. We have a whole group of technicians. There are animal health care technicians that work in our receiving area, and these people are very important, and they do the aging, they determine the sex, they weigh the kittens, they check for any abnormalities. So any kittens coming in that have a problem or may not be quite normal, those kittens are going to be on a pathway to receive an exam by the veterinary team or the shelter veterinarian. And this is important to cover because basically what this shows is that the population of kittens in this study that are in foster care have already been dewormed and received coccidia prevention, and so those causes of GI disease are going to be low in this population.
Yeah, that's a really good point because, if, for example, if we don't show that there was an effect of panazole on kittens with diarrhea, that could certainly be interpreted as that it didn't work, but in fact, there was very few kittens in the study that probably even had coccidia infection. We'll talk about that in a little bit. But Sandra, during the period of time of the study, you had sort of a go-to bag of treatments that you would treat the kittens with, and those constituted the treatments that we specifically looked at to see if they gave a survival benefit to these kittens. Would you like to review for the group what those treatments generally were?
Yes, so let me reiterate, as Jody mentioned, that for the study, what we did is we kept a log in the shelter, and so I want to give a brief thank you to the shelter staff and the veterinary team because they were instrumental in tracking this and logging the kittens. And any kitten in foster care that came back to our clinic area to be seen for diarrhea was logged into the system. We also kept track of their weight, what their sex was, how old they were, and then eventually, of course, the outcome. We logged what treatments they got. This was really based on the veterinarian on duty. Most of the time it was myself, but we have other veterinarians that work with us, and we're grateful for that. And so this is a list of the treatments that we were using at the time of the study. The vitamin supplement is high vitamin drops. We started using that because one of our employees, who's also a foster, mentioned that she really thought it was working and helping her particular foster kittens with diarrhea. We were using probiotics, mainly Fortiflora, at the time that we were logging this. If we thought a kitten was showing signs or we were concerned about coccidia, we went ahead and treated with the panazole for a 3-day course of treatment instead of the one-time preventative. And then there might be times when kittens received antibiotics depending on what we saw or what was going on. Penicillin was usually reserved as subcutaneously for the very sick kittens that we were worried about being septic. Metronidazole is a common antibiotic used to treat diarrhea in a lot of animals. We also looked at nutrition. We would log whether or not the foster reported the kitten was eating. We would see whether or not the kitten would eat. For us there in the clinic, sometimes the foster would report the kitten not eating, and we would offer a different kind of food or some warm food, and they would eat for us. And then, of course, we provided supportive care for these kittens. That would come sometimes in the form of subcutaneous fluids, sometimes appetite stimulants, warmth, things of that nature. So this leads us into the next.
Yeah. Well, we couldn't help when putting together the presentation, but to want to be able to sort of poll the group on what treatments that you all are giving, because it's such a unique opportunity to share practices. And one of the questions that we had for you that we wanted to throw out there was whether or not you routinely use metronidazole in your kittens with diarrhea. And so we, nowadays there's a lot of discussion about the use of antibiotics, especially in young animals with developing microbiota, and the possibility that the use of these antibiotics may, in the long run, be detrimental. I think there's a lot to be said about that, not a lot that needs to still be studied. But let's see what the group in general thinks about this. All right, what we expected, the majority of you, about 78% of you do use metronidazole, but 22% of you don't, which actually I find interesting that that larger percentage of people don't use metronidazole. Let's find out. Again, I think Sandra's pushing me forward here.
Sorry. No, I was just going to point out the larger percent do use metronidazole, which isn't necessarily surprising because we, as veterinarians in clinics, we historically have reached for metronidazole.
Exactly.
Diarrhea.
I mean, like what we learned in school, and I'm not saying that we shouldn't be reaching for metronidazole, I'm just putting the idea out there. In school we learned that it has anti-anaerobic activity, it treats Giardia, and it has these nonspecific anti-inflammatory effects, and I feel like in dogs it definitely works, but I don't know, and Sandra and I didn't know whether or not we thought it really worked that well in cats. So our next question is, if you are amongst those that use metronidazole, do you feel like you're seeing clinical improvement of the diarrhea in kittens? So let's see what you guys thought. Okay. So it seems that the group is finding that metronidazole is beneficial in kittens. And so, it's hard to, obviously we're just kind of opening up a discussion here, but it's hard to not use an antibiotic that firsthand experience with helps these kittens. So we're not here to say whether or not you should use it or not. We just thought it was an interesting thing to discuss.
But we did want to point out that there is a growing body of research on the microbiome, and so we just are looking at trying to think through before we just reach for an antibiotic what consequence that may have. We know that orphan kittens are trying to establish a healthy gut flora, and so that's part of what we're looking at and why we're here and why we're discussing this.
So the next thing that we wanted to ask the group was about probiotics. So the question is, do you routinely use probiotics for treatment of your kittens that have diarrhea? So let's give a second for that. Clearly, the probiotics are all the rage right now. There's numerous types of probiotics available. We don't know if they help. We definitely don't have any information to suggest that they're harmful. So how many of us are actually using these? Survey says, almost all of us. So that makes sense because, like I said, we've got kittens that have a changing intestinal microbiota. We know that it's disrupted. Indeed, it's been published that it's disrupted in the setting of diarrhea in this population. And this is a very physiological way to potentially restore normal gut health in these kittens. The surprising thing is how little we know about what kind of probiotics they really need and what impact they actually have. So I'm curious what types of probiotics that the groups are using. I've listed 3 here that are they're prescription probiotics, some of which you probably might not even have heard of, like Visbiome, which is a new player on the market. But what are you guys doing in terms of your go-to probiotic? Fortiflora, exactly. So Fortiflora's had the market for a very long period of time. We're all familiar with Fortiflora. Fortiflora contains Enterococcus faecium and a mixture of some vitamins and minerals and like a protein extract that tastes really good. So cats like to eat Fortiflora, which is actually makes it beneficial when you put it on their food because it kind of makes them want to eat the food because it tastes so good.
Yeah, it's easy to use.
Yep.
So,
and many of you look like you're using other types of probiotics, which is not surprising since there's just so many of them on the market, and some of which may be more economical for use in the population. But it's interesting because in our study, metronidazole and Fortiflora were used quite frequently, and so we were able to assess, at least in our population, whether they had any outcome in survival of these kittens. So for no more stalling, let's go forward and talk about what we found in the study. So first of all, I need to give a big call out to the Wynn Feline Foundation and co-sponsored by PetSmart Charities, who have been extremely generous in providing funding to both Sandra and I to foster these collaborations that we have. In fact, the work could not be done without them, and I can't say enough wonderful things about both of those organizations. So in this study, Sandra looked at, I should say, between April 2016 and July 2017, this group of kittens, which was 1,718 that were relinquished to the Wake County Animal Center. They were all unowned, less than 12 weeks of age, and less than 2 pounds of body weight. And in this population, 172 of these kittens, so 10%, ultimately were presented to the shelter veterinarian because of diarrhea and underwent treatment. Now, what I need to clarify is that there is a set of kittens that presented due to diarrhea and did not undergo treatment, but were euthanized, that did not enter this study. And the majority of those kittens were diagnosed with panleukopenia and humanely euthanized. So this study looks at, generally speaking, non-panleukopenia related causes of diarrhea. And so that's a really important caveat, because we can't say that the things that we tried in the study would have any effect on panleukopenia or not. That is such a population that's deserving of focused attention, but is not really addressed in this study. Now, among these 172 kittens that underwent one of these treatments or more for diarrhea, 89% of them survived to adoption, which I think is remarkable. And 11%, though, died or were humanely euthanized due to the severity of their disease. So what were the real positive outcomes of this study? Well, here in the box, we have the treatments that we administered that Sandra already talked about. So a vitamin and mineral supplement, probiotic, panazurol sub-Q fluids, penicillin G, metronidazole, or tube feeding, so assisted feeding. And what the big two take-homes in this messages in this study was that kittens that received a vitamin and mineral supplement were 13 times more likely to survive than kittens that did not receive the vitamin and mineral supplement. Now, I can't tell you how excited we were to see this, because those kinds of numbers are really uncommon to pull out of a study of this kind of nature. What we also observed was that kittens that were greater than 4 weeks of age were 25 times more likely to survive than kittens that were less than 4 weeks of age. And there was an interaction between these two variables. So when we say the kittens with vitamin and mineral supplement were 13 times more likely to survive, that is when taking under control and impact of their age. In the study, like Sandra mentioned, we used a vitamin and mineral supplement called Hi-Vite drops. I think it's important to recognize that this formulation contains a lot of stuff, like so many different vitamins and minerals and extracts and things, that it's absolutely unclear what in this concoction or things in this concoction may have contributed to the survival of these kittens. And I think it's important to point out that we don't know that this is the important supplement to have, or any broad spectrum vitamin and mineral supplement could be beneficial for these kittens. I think the point here is that something as simple as providing vitamins and minerals to these kittens could have such an impact on their survival. Now let's talk a little bit about some of the other things that we looked at in the study. So first of all, let's talk about fortiflora. So we found no impact of fortiflora on survival in the study. Now, what I think is really interesting about fortiflora is that it also contains vitamins and minerals and protein extracts that would presumably also benefit kittens. But when you look at the types of vitamins and minerals and such that are in fortiflora, they are not the types of vitamins and minerals that are necessary and required nutrients for the health of cats. So for example, We know that kittens and cats require arginine. They require vitamin A, vitamin B, niacin, higher amounts of thiamine. None of those specific requirements are contained in Flora, whilst all of them were present in the other vitamin and mineral supplement that we used. So I think it's interesting that it's fairly clear based on the content of vitamins in Flora that it wasn't necessarily concocted with cats in mind, for lack of a better explanation. So although the vitamins and minerals are in there, they don't seem to be in the forms or the types that seem to be most impactful for kittens. We found that treatment with sub-Q fluids, penicillin G, and tube feeding were associated with non-survival. Now, tongue-in-cheek, we don't think that these treatments actually killed these kittens. What we believe is that these treatments were reserved and administered to kittens with the most severe diarrhea in the study, and therefore they ended up being associated with the kittens that didn't end up surviving. We found no impact of panazurol on survival, and again, I think that's probably because we had already really cleared out coccidia in these kittens, so very few of them were tested, and those that were, very few had actually coccidia. So I think that probably isn't fair to say that that wouldn't have an impact in a population of kittens that did have a high prevalence of coccidia.
Exactly, yeah. Panazurol is a very good medication for treating coccidia in kittens. Ours just didn't happen to have a high burden of coccidia.
And we didn't see any impact of metronidazole on survival, either positive or negative. And I think that one of the drawbacks to this study is that we didn't actually look at the impact of these medications on resolution of the diarrhea. So these kids would come into the shelter for diarrhea, they get treated, they go back home with the foster care provider, and we didn't follow up and say, did the diarrhea go away? Now, presumably, if they survived at the end of the day and were spayed and neutered and placed with a new home, the diarrhea resolved. But that is one shortcoming of the study, is that we didn't really assess the impact on diarrhea, we assessed the impact on survival. And that was just simply based on the fact that it's very hard to conduct these types of studies in the real world. So we were pretty happy with what we were able to find in the study. So Sandra, do you want to just talk about sort of what some take-home messages are more globally and specifically related to the study?
Absolutely. So the big picture take-home recommendations here are that we want to continue to vaccinate on intake any kitten 4 weeks of age or older. We know from our population, panleukopenia or kitten parvo has a high mortality rate, so we want to provide that protection early. We want to use a broad-spectrum dewormer. We want to treat for coccidia intakes. We know stressed kittens are more likely to come down and be shedding coccidia. We want to consider easily digestible canned food. There's newer studies coming out showing that canned food that is high in protein, low in carbohydrate can be beneficial for kittens and cats, and we want to keep looking at those studies that are coming through. And then probiotics, we have a question mark. We only used one type for this study. I have a lot of hope for probiotics. We'd like to see some more cat-specific probiotics that have the cat microbiome in mind and cat nutrients come out on the market. And then, of course, the vitamin and mineral supplement, what we found, the 12.8 times more likely to survive if we administer this to kittens that have diarrhea. And then we can't don't forget supportive care for these kittens. They're small, they may have trouble thermoregulating, so warming them up. They're easily dehydrated, providing fluids, things of that nature are very important for this population.
Okay, well, we want to wrap it up because we'd love to answer some of your questions. Just some take-home thoughts of things that are bouncing around in our heads of places we'd really love to focus some time and energy into better understanding these kittens and helping to save their lives is more information about their micronutrient requirements, the role of diet in these kittens as we transition them from mom to actual food, the impact of these on their microbiome, their gut immunity, and environmental factors that may interplay in their susceptibility to diarrhea. But with that, Sandra and I thank you very much for participating, and we hope we can answer some questions.
Thank you.
Great. Thank you so much. That was excellent. And we do have a few questions here, so we're going to go over our time limit a little bit. So let's start with this one. Were all the kittens on the same formula and wet dry food? If so, which ones?
No, and that's an astute question because this was a foster-based study, and we really don't have a whole lot of control once they leave our shelter. We recommend, high-quality canned kitten diet, high-quality dry kibble, but as anybody in sheltering knows, that's something we did not control for, and we realize that as being one of the drawbacks. We also rely a lot on donated food in sheltering, and so we do believe diet has an impact on kitten diarrhea, but that was not looked at in this particular study.
Okay. The next question is about the vitamin drops. Were high vite drops administered alone or in conjunction with other treatment?
That's a good question as well. And so because we weren't trying to impact or change the treatments while we were capturing the data, the high vite drops were often administered in conjunction with, say, metronidazole or a round of panazerol if we suspected coccidia. And so they were not administered. At times they were administered alone, but that was not the case. We just kind of did whatever the treatments were, they were prescribed. I will say the high vite vitamin drops, we did draw that up for the fosters in individual syringes, and it was given orally, and that way we know that the kittens actually received that supplement. We also hypothesized that just getting that vitamin and mineral, in the kittens orally via syringe may have been helpful in stimulating appetite and getting them to eat or to getting those nutrients into the kittens.
Okay, and I just pushed another question that's related, obviously, which is, was there a certain dosage in that syringe?
Yes, very good question. And this was really completely off the cuff, but we went with 0.1 ml per pound of kitten. And again, we pre-drew that up and gave that out, prescribed that out to the fosters. I want to also say that this isn't a treatment we kept them on indefinitely. We started with 0.1 ml per pound for 3 days in a row, once a day for 3 days. Sometimes we would extend it to 5 days, but this is a high nutrient supplement. There's a lot of iron in this, and so we didn't want to go overboard. We don't want to over-treat. And so there were times when I might repeat the prescription, but we did not, it wasn't something that was administered indefinitely. It was either a 3-day course or occasionally a 5-day course.
Okay, and here's another dosage question. What is the proper dosage, if there is one, of Fortiflora?
That's a great question. When you think of probiotics, I haven't seen a lot of research on what is a dose for probiotics. I have heard more is better. Some would say, give it twice a day. We also know from human studies that the probiotics have to be taken in daily, and once you stop, they're no longer beneficial. Maybe Dr. Gookin, maybe Jody has a comment on that.
No, I do not know what the proper dosage is of Fortiflora.
Okay, well, we have a few more questions, but I think we're going to have to move those over to Maddie's pet forum because we are running a little over here. So we want to thank our viewers for watching, and for viewers who'd like to continue today's discussion or have other questions on this topic, please visit the Maddie's Pet Forum webcast group. For those of you watching on demand, you can take a short quiz to qualify for continuing education credit. We'd like to thank Vetiquinol for making this webinar possible. As always, a million thanks, or perhaps 2 million, to Maddie. And thanks to all of you for watching and all you're doing to help the kitties.